Good morning and Happy New Year as we roll into 2026. Obviously, January is a huge time of year where people are setting new goals for the whole of their life, whether it's their finances, their health, their relationships, what have you. So today I just wanted to address what the options are through seeing a professional health practitioner for body composition, because there is so much out there, there's so many options. So I wanted to just explain what we do here at Live Well and how we support people on their journey to improve body composition. And let's face it, at the end of the day, most chronic disease is related to body composition. So we know that 92% of Australians die of chronic lifestyle preventable illness, and diabetes and obesity and heart disease and all of those things are often related to being overweight. So it's not just about aesthetics, it's not just about looking great, it's about how do we get health and longevity and minimise the medical interventions that are required. So as I said, there's a massive amount of information out there, so I'll just explain what we offer and what are the differences and why. So firstly, let's address GLP1s. So that's a term that's pretty much become a household word now. Most people know what Ozempic and Mounjaro and Wegovy are. If you use those drugs standalone, obviously you get amazing benefits. But if you combine those drugs with nutritionists and professional support, you can really optimize the results. So this is something I do all day, every day, is I help people on these medications to make sure their protein status is correct, to make sure they're not losing muscle, to tweak side effects if they've got diarrhea, if they've got constipation, if they've got nausea, if they're dry, if their fluids aren't correct. So I help them monitor their progress and troubleshoot along the way. And it really gives a fantastic outcome when you combine the two. So they're seeing their doctor for their prescriptions and they're seeing me usually monthly for optimization. So we've got to really look after that nutritional status, because people have that tendency, because of the drugs, that they may undereat different food groups or undereat certain things that we really need to preserve that muscle mass. So that's number one. So you can see a natural healthcare practitioner like myself to support you to use pharmaceuticals, and you will get better results. And we also help people with the weaning process. So they get to their target weight or they want to reduce their medication, and we have natural supplements and advice to help you with that process, so that you're not just like coming off cold turkey and rebounding. So that's number one. We can help you just if you're on GLP-1s. Number two, you don't want to do GLP-1s. You want to use food as medicine. You know, I've banged on about this for 5 years now, but Metabolic Balance is the most successful program I've ever seen. For those of you who don't know anything about it, there's lots more information on our website. And if you just look on YouTube and search Metabolic Balance Expert Panel, which I've been on for a couple of years, you'll see a host of videos there explaining it. But in a nutshell, it's a completely individualized program from Germany. Every single person's plan is different. The plans are generated based on a heap of blood results, which we get done first, and your medical conditions and your physical makeup, like your weight, your current weight, your waist measurement, hip measurement, etc. The program comes with professional coaching, app, recipes, everything you need. 5 years down the track, still absolutely love this program and see phenomenal results all the time. So those of you who've been in recently, you'll notice Beck, our Monday, Tuesday receptionist, unbelievable. She's just released 12 kilos over about 10 weeks and done it easily. And you know, we have hundreds of people on our books that have done that. So Metabolic Balance is your professional food-based alternative to GLP-1s, and obviously we offer that at Live Well. So myself and Rose, 5 years experience. We know the programs inside out. We know how to navigate any hiccups you have. We know how to get you through holidays. We know how to help you travel, all of those things. And that's an all-inclusive package. So like I said, lots more information on our website. And then imagine if you combine the two. So the third option that has become it's not our most dominant option yet at Live Well, but it's certainly something we do a lot of, is both. So people are using some GLP1 medication to stop the food noise, and then they're using Metabolic Balance simultaneously to make sure they're eating exactly the right foods for them. Because Metabolic Balance dictates, which green vegetables you're going to eat, and which fruits are best for you, and which meats are best for you, and right down to which cut of meat is best for you. So when you combine the two, it's miracle season, I tell you. It is unbelievable. So we have all of those options available, and we get amazing results with all three. And sometimes the progression at Live Well is exchanging the options. So you might come in and you start with Metabolic Balance and you go gangbusters, and 10, 15 kilos comes off and everything's better and inflammation's better and you're feeling great. But you're feeling that, you need a little bit more help to nudge that final 10 kilos or something like that. You might bring in an injectable for a period. So we use both. We use just food as medicine and professional guidance. We just assist people on GLP-1s, or we combine the two. So whatever your goals are for 2026, I can honestly say that you'll get a better outcome if you have some professional support along this journey, because it is overwhelming, all the stuff on social media. Take this, take that, do this, do that, don't eat this, eat that. You've got the madness has to stop. So trust the people who've studied this all the time, who've got the qualifications to guide you through this journey. And, we're here to help the doctors as well, because they're being overwhelmed with all the people wanting to use these medications, but they don't have time to help you with the nutritional side of it. We do. So we're going to help you when you say, look, I'm really not hungry and I can't get in breakfast. We're going to troubleshoot that and say, well, look, hang on. Let's have a scoop of collagen in your coffee, and let's put a little bit of creatine in there and support your muscle mass, and you're not going to feel bloated and full, but we need to get those protein ratios in. So I hope that's helpful. We have lots of options, and we really look forward to supporting you in this journey, because it is truly wonderful to see people have the transformations that we've seen in the last few years. So I hope that was helpful, and look forward to helping some of you soon. Thank you.